in all of the state is now aligned, and you're a lot safer than you have been the last 10 days since Dallas County first implemented the order. And this means, for instance, the 1 million people in Collin County will be under an order that is essentially the Dallas County order. I think effective, I'm not sure, midnight perhaps is when that goes into place. There are a few differences, and I'll go over those, and they are as follows. His order does allow for the prospect of religious services that cannot be conducted at home or through remote services. When I saw that, that was an immediate concern, because the last thing we need are little churches that don't have the ability to broadcast online, meeting with 30 people in a small home, and then finding that suddenly somebody had COVID and they're all sick. And so I quickly called together a faith leader call within minutes of reading the governor's order. I said, what do we do? And immediately Pastor Ricky Rush said, Judge, I'll open up my studios and our know-how for any church that needs to broadcast. And then Pastor Tommy Brown said, I'll do the same thing. And then Bishop Kevin Burns said, I'll do the same thing. And then Paul Rasmussen from Highland Park Methodist said, I'll do the same thing. And then T.D. Jake said, I'll do the same thing. And then people from the Jewish Federation, Jewish Family Services, I think, I may have that name wrong, said, I'll do the same thing. So here in Dallas County, it essentially won't change, because as the governor's order says, if religious services cannot be conducted at home or through remote services, and every faith community here in Dallas County will now have access to doing it through remote services. After that call, I had a call with Congress. I find the best way to get things done, actually, a lot of times is for me to ask for it on television, so let's do that real fast. We are in critically short supply of PPE. I've asked a bipartisan group of congressional delegation from North Texas, every congressman who has any part of Dallas, to do what they can to open that up. We need PPEs perhaps from other federal government sources, so that we'll have the time to build our PPE capability here. That is going slower than I would like. I know everyone is working hard, but we are having hospitals that don't have the PPEs that they need. And the nursing homes don't have the PPEs that we need for them. And Phil will talk to you. That's kind of a piece of not such good news that Phil will get to. But we need those masks on those nurses at all times. I asked them for 400 more tests a day capability at Ellis Davis Fieldhouse and at the AAC. And let me just explain to the federal partners at the top level, this is critical. We need visibility into what's happening in our community. Our people need testing. And I know there are plenty of people in the federal chain that want us to have it, and I just need it turned on. And I need a reversal of the federal decision to cut our money off on April the 10th for our testing. I think that is a bad decision, and we need that testing. And so our members of Congress all bipartisanly agree with that, and so we are going to work to get that turned back on. Latest visibility on the field hospital. Our hospital CEOs meet with Peter Urbanowitz, my special assistant for a unified healthcare response. They all thought about it. They brought their chief medical officers onto the call. They decided that what would be best for us is what's called a COVID step-down unit. What that means is you're very sick in the hospital, then you get better, but you're not good enough to go home, so you go to the COVID step-down unit. It's not quite as intensive as like if you're at UT Southwestern, Parkland, and what have you. There is an issue with that in that, that's not in the Navy's mission statement at present. What they're doing in their Mercy ship off the coast of New York is, in that instance, they do other things to free up bed capacity at the hospitals. Our hospitals decided a better alternative is what we're asking for. They have asked for a mission statement letter from me. That will be prepared tonight and will work its way up through DOD, and hopefully that will be an exemption of that mission statement. If not, we're told that Public Health Service or someone else will step in to try to help us. We have a lot of friends in that chain, and they're doing tremendous work, and we very much appreciate their bravery and their service. Let's see, what else do we have on that? I want to, let's see. We are making it countywide that all effective midnight tonight. These are summary changes for the order today. We are making it countywide that all public, private, and commercial laboratories operating within Dallas County and performing COVID-19 testing shall report by 5 p.m. each day for the prior 24-hour period the number of COVID-19 tests performed and the number of COVID-19 tests that I think that were positive. Yeah, somebody meant to put positive on there. This is in line with what the city of Dallas is doing. We're just making that countywide. Let's see. We're also doing a countywide bed capacity and vent capacity. So we're requiring certain hospitals, system hospitals, and the county hospital to provide daily reports of the total number of patient beds and patient beds occupied, intensive care unit patient beds and intensive care unit patient beds occupied, and ventilators that are available and ventilators being used by patients. We've added safety rules for essential workers. I want to thank my friend Gary Huddleston at the Texas Retailers Association, who led that effort, along with Fred Perpall, my special advisor for essential business worker safety. This includes grocery stores, gas stations, pet supply stores must all follow these rules. It includes also big boxes like Home Depot, Lowe's, Walmart, and I can give you a little bit on that. But essentially, we had the business folks work on that in a committee. Then we had the Workers' Defense Project, the Texas Organizing Project, the AFL-CIO, and some other worker groups that I'm probably leaving out. I think a couple more work on it. Of course, the food workers, that represent the grocery store workers. United Federation of, well, I'm going to mess that up now. I'm sorry, guys, but my friend Anthony here in Dallas that works with him. We had those folks at a table. We listened to both sides. We came up with a deal that both sides are happy with, and so that'll go into place tonight. Before we get to some of the bad news, let me say one more thing about our grocers. They have just stepped up big time, y'all. And these are heroic things that they're doing, both at the top level and the people that are in the store. And so what I need you to do is I need you to not go to the store every other day for 2 or 3 items. I need you to write that list down. Some of you, and my wife and I were both like this. We would just not really write a list down. We'd go get a couple of things. We'd go back another day. But you really need to write a list. We just need you to go in there one time. It's not safe for you. It's not safe for the workers there and the other people if everybody is crowding or just hanging out at the grocery store. If they're two able-bodied people, or if you've got some kids and there's somebody at home that can take care of them, please don't take them to the grocery store or the big box store. I know everybody's getting cabin fever. I get it. I've got it too. But we can't hang out in the essential retailers. We just can't have an outbreak there. That's the supply chain that's going to feed you and take care of you. So we've got to protect the people that are doing that. Speaking of heroes, let me tell you what our grocery stores are doing. And I want you all to know this and take advantage of it. For those of you who are unbanked, the grocery stores have agreed, several of the big ones, Kroger's, Walmart, Tom Thumb. I can't remember. I'll have a complete list when we're putting up a website with a ton of information for you. There's a problem with a link that I'll get fixed as soon as I'm done with this by calling someone smart to fix it. They're waiving the fees and they're cashing checks. I've heard a lot of people, say, well, this non-depository lender closed and And our service to the community was that we cashed checks as well as made very high interest loans to the community. Look, you can go back to doing that. We're trying to limit, you can go back to doing that when this order's over with. But as long as we have this order, it's only essential businesses that are open. If the services that the community needs can be readily available somewhere else, then those folks are not open. And so with the grocery stores stepping up and doing this, we have those services covered, and I appreciate that very, very much. And again, it's just a matter of if there's a way to get something without every business being open and every business being crowded with people, that's really what essential business is. So that takes us through those summaries, and I'll let Phil fill you in on some of the news of outbreaks.
Okay. So we do this today. We reported 82 new cases, bringing the total to 631 for Dallas County. We also reported our 12th and 13th deaths. They were 2 males, one in their 50s, one in their 90s. Also noted that in the past week, we've had a total of 27 cases associated with long-term care facilities in Dallas County, including 2 deaths in those facilities. I'll go a little more detail into some of that. So at Monticello West, we had 1 resident confirmed positive and 1 staff member confirmed positive. At Skyline, had 17 residents confirmed positive. Edgemere now 6 total confirmed positives in staff and residents. That's a breakdown of 4 residents, 2 staff, including the 2 deaths that we've reported from Edgemere. At the Reserve in Richardson, 1 resident confirmed positive, and at Westridge Nursing Home, 1 staff confirmed positive. Also in the jail, the latest numbers are 17 confirmed positive. So this is hot off the press, our latest, the map of all the cases in Dallas County by zip code, so the geographic distribution for that.
Dr. Wall, what was that last after you said Richardson? What did you say, Westridge?
Westridge, 1 staff person.
So can you talk about why we're getting more positive, in certain zip codes? At first it peaked in 75225, but now we're seeing more. Is it because we're having more tests available there, or what are we seeing there, the peak in certain zip codes?
And we've discussed, some of those factors. I mean, one of those initially was probably that was an area where there was more travel. Again, our initial cases were travel-related people who had the means and were doing more, whether overseas travel or other travel. Now it's, as we've had more community spread, there are other factors. And access to testing is certainly one of them.
Access to testing, travel, density, it's a dense area. And what it is, another thing that it shows is once you get a cluster, and it begins to grow out, it's kind of like lily pads in a pond. First there's 1, and you hardly notice when there's 2 and 4 and 6. But if they keep replicating, pretty soon they've choked off and filled up virtually all the pond. So that's what we're seeing in some of these neighborhoods. And of course the lack of testing. This is we'll say this again. The question was about testing. Why do we have more cases in University Park than any other zip code? The lack of that testing and that visibility for the 500,000 people that don't have health coverage who work in Dallas County is a huge problem, and it is something that worries me, and we need that testing, and that's why I'm here asking our federal partner to reverse their decision on cutting our testing.
Judge, your current order does require people in a long-term or skilled nursing facility to test negative for COVID-19 before they can leave, correct?
It does not. There may have been a typo in the rush to get an order out, but what the first order does, and it'll now include Westridge, once there's a COVID positive case in the nursing home, okay? And that would include staff. Once anybody in that building is COVID positive, then you need a COVID negative test on your loved one to take them home. Every other nursing home in Dallas County, you do not need that. So if you have a loved one in a nursing home that's not Monticello West or the Reserve in Richardson, Edgemere Skilled Nursing, not any of the other Edgemere buildings, but Edgemere Skilled Nursing, Skyline, or Westridge, you don't need the test to take your loved one home.
And we've had families from
I know.
nursing homes that have the positive test, that have loved ones who now want to leave based off of your statements on Sunday night, and they're not able to do so because there are not enough tests for even those who maybe have symptoms. Is that correct?
Well, it's getting harder and harder for us to get testing as this spreads through the nursing homes. But I've directed the various Health and Human Services and Parkland to assist. We need those. We need the nursing. Let me repeat his question. What's our situation in a positive nursing home where there's not enough testing? Okay, and so I've directed Health and Human Services in Parkland to assist with that. We're going to need the nurses at the nursing home to swab, and then we can try to expedite the test. As this moves through nursing homes, and it's 4 days ago it was 1, and 3 days ago I can't remember, it was 2, and today it's 5, and so as it goes through enough of them, it gets hard to do that. And that's another reason, federal partners, why we need you to reverse your decision and leave our test here and add more to it.
Just to follow up, so what would be the message to families who are trying to get their healthy loved one out of one of the nursing homes that has a positive COVID-19 test?
The message, unfortunately, and this is for public safety, is, and we'll try to help you, but you've got to have a test, and your loved one has to test negative to get them out of there. And time is of the essence, the way this spreads through nursing homes, that we get that for you. And so we're going to do everything we can to get that for you. But again, if you want to make those decisions, you might want to make them before there's a positive in your home. And let me just reiterate this. I've said this before. It's my job, when I talked about us having a difficult conversation, it's my job to get you the information that you need to make the best decision for your family. Each family is different. Each healthcare and family capacity is different. So what works for one family may not work for another family. It's important that we extend grace to everyone, but I would not be doing my job if we didn't give you the unvarnished facts about what's happening in nursing homes. One other thing that Phil can speak more to, that we got from on nursing homes, that we got as a guideline from CDC this morning, is that there is a significant population in the nursing homes, at least on the preliminary study that was done on the nursing home outbreaks on the West Coast, that are asymptomatic carriers. That means that, unfortunately, we thought maybe we were doing we had a good handle on it if we just found the symptomatics and isolated them. But it means if you've got a COVID positive, and the idea was, I was discussing with the doctors, let's clear Monticello West, since the person that was a positive there has been in the hospital for a long time, and we've had no other positives come up. But the CDC guideline from this morning would indicate that you may have asymptomatic COVID positives there. And of course, the way things are going in America, we don't have enough tests to test the people in the home. So we're not going to be able to clear a home at present after the home has a COVID positive. You can still get your loved one out if you can get a test for that person. It's a very, very difficult. All these decisions are just, frankly, gut-wrenching and terrible. But that's where we are right now, is you've got to have a negative test before you take a person out of the nursing home.
Judge, if you had to say tonight your top 2 biggest concerns, with today being the largest daily report that we've had since you guys started really tracking this and publicizing it, what are your top two most important concerns right now for Dallas County?
My top concern was that the governor would follow, what the hospital association doctors and hundreds of thousands of citizens. I want to thank all those people and move to a shelter and safer at home stand, and he has. So, that was the top thing. Second thing is bed capacity, vent capacity. That's not the top thing that you're worried about right now, but it'll be the top thing that we're worried about in 2 or 3 weeks. So we're trying to work on that. There's real good compliance out there. I'm very proud of the compliance of where people are. But we've got a few people that are not so compliant. So we just ask that those who are not being compliant, move from non-compliance or selfishness to sacrifice. It's not fair if our neighbors are following the rules and you're prolonging this terrible situation by not following the rules. The other thing that is, on my mind today that we're getting really low on PPEs, so we need PPEs. I would again call on industry. We will pay you. It's not that we're not asking you to do this for free. Anyone that can make PPEs, if you have a shirt manufacturing facility, whatever, if you're currently not on because you manufacture clothing, you could turn back on if you manufacture PPEs, and we have hospitals that are ready to pay you to do that and pay you at a profit. So, help us.
Judge, I know you're an optimistic kind of guy, and you're trying to see the best in the governor's order, but he said, and this is the quote, "This is not a stay-at-home strategy." Are you worried about people getting confused by the governor's rhetoric and what's actually in the order and what's happening here in Dallas County and in Collin County?
Well, I think there's, it was very hastily put together, right? And I don't mean that in a negative way. It was just, he made the decision to move to a safer at home posture, put something together. Doesn't want to call it a safer at home posture. I don't know what his words are. What does he call it? I don't know.
This is an
essential business order. Okay. So what happens is what an essential business order is also the same thing as a safer at home order. What it says is, if you work at an essential business, you may go to work. If you don't work at an essential business, you may not go to work. What it says is, if there's a way for you to worship other than together, you must do that. So we just fixed that problem. That was the only real difference in the two orders. The essential businesses that he defines are those under the Critical Infrastructure Security Act. Same thing as our businesses, so no big difference there. He doesn't have the safety guidelines underneath, but what I'm understanding is he doesn't object to our safety guidelines. He prefers a very broad order. I wouldn't be surprised if Dr. Birx or someone puts out something, some guidance to governors that have reached a certain threshold, maybe tomorrow, and his order will mirror that. And then he likes to leave it up to the locals to come up with the regulations. Also, what this means for people, I keep telling folks this, but sometimes they don't believe me. Our Commissioners Court likes to have a meeting, likes to wait until the last day of an order and then have a meeting and extend it. I think some small businesses are hoping that maybe they can lobby the court, and they won't do that. The court is aligned behind this strategy. There's not a member of our court that doesn't want to put public health ahead of the economy right now, as tough as that is. But even if the court weren't to do that, the Dallas County Safer at Home order is statewide until April 30th. That's where we are.
And then just really quick, it looked like in the zip on the map that there is no longer any zip code in Dallas County that does not have at least one case. What does that mean to you? I mean, what does that mean to you?
Well, so we're at the beginning of this. We're just at the very, very beginning of the curve. We're going to see a rise. How steep that is going to depend on how effective our executive orders of 10 days ago are, that were quickly followed by Harris County, and then Judge Stovall in Hunt County, which his advocacy on a call the night before Tarrant County changed their stance, I think it was big, and so I want to give credit to him on that. But you quickly saw, I think we did it 10 days ago. I think 6 days ago, the rest of the Metroplex did it, with the exception of Collin County. And so hopefully that will help. And certainly what the governor has finally done is definitely, helpful. So we'll just have to see how steep that is. It looks manageable right now, so we'll see.
Judge, nationally, there's been obviously a lot of focus on New York City and Detroit and New Orleans, but at least early this morning on some national platforms talking about, is Dallas going to be, the next kind of spot that pops up? Do you think that is premature to do that, or where do you see that?
Well, that was on Good Morning America. I actually tweeted that, I think, at the governor, because we were still working on getting him, or I was still working to get him to lobby him, and others were as well, to get to where he is. But that is a group of doctors that say Dallas is next. Guys, nobody really knows. Okay, the hope is that by acting aggressively and you being compliant with those executive orders, that we won't be next to the scale of New York. That's just some doctors' best guess, but there's no scientific studies on this novel, fast-moving pandemic.
I mean, I know your order technically ends Friday, the governor's order. I mean, I know you're only able to do a certain chunks of days. When are you going to extend, or are you extending?
We will extend, because underneath our order are all sorts of safety rules that we've worked with industry and worker groups. And there's all sorts of protections for at-risk communities that aren't in the governor's order is just the very broadest thing. Like his essential business definition is any business under CISA. And we've spelled out all sorts of things for each type of business. So we'll extend those. We'll continue to lead on this statewide effort. We'll continue to push for worker safety. We'll continue to push for public safety, for public health, and we're going to lead on another thing we're going to lead on is tax relief for our population. I'll roll out a proposal to the Commissioner's Court on that later. But here's another thing, Governor, that you could help with. Our appraiser sent you a letter, and we asked you to put in your emergency order a tax freeze on the upside, so they can't go up, but it could go down on the appraisals for every business and every homeowner. My preliminary numbers are that we may see actual increases in our commercial appraisals based on comps at a time when our economy is taking its, I think it's the worst quarter for the economy, in a long, maybe since the Depression. So these small businesses can't afford that, and certainly families can't afford that. So if you do that, that would help us. I'm going to try to figure out ways to do that if you don't, but I'm not sure all the tools are in my toolbox to do that piece. I've got other pieces that I can do, and with the help of the Commissioner's Court, and so we will do our part. But that's a very simple thing, and we would just ask that you reconsider that and do that as well. Any last questions before we get out of here? if not, I think the takeaway for today is good. You are safer tomorrow than you've been for the last 10 days, now that the state and the whole region has moved to this safer at home model. We can do this, but it takes the sacrifice of everyone. Things will get worse before they get better, but we will get through this together. And I thank all of you, for what you have done and what you will do. And I just ask that everyone practice self-care and make sure that you and your family unplug from this and spend some time doing something meaningful other than watching ugly guys like me at news conferences. So thank y'all.